Hi, everyone, and welcome to another episode of Aila Health's Patient Spotlight series. Today, I am speaking with Christine Horstman, who is a certified professional coach, a certified career coach, and a professional development instructor. She is also a chronic illness warrior who now adds long COVID to her medical resume. Her poem, The Long Haul, was published recently back in May in the Common Language Project anthology ritual. And her first book, Deal With It Doll, a guide to coping with and overcoming life's many challenges, will be published later this year. Christine currently lives in Dallas with her husband, son, and fur baby. And we're so glad to have you here with us. Christine, welcome.
Thanks for having me.
So I thought maybe to start, I know you have a history of chronic illness, and long COVID is just one of those for you. And so it sounds like most recently living with long COVID is what's very prevalent for you. But just wondering, to start, can you maybe give us an idea of what your diagnosis journey has been like?
Sure. So honestly, it started a long time ago. I had really horrible endometriosis in my 20s, to where at 23, they told me I was going to need a hysterectomy. Thankfully, that didn't happen for 20 more years. I was able to do some actually pretty, at the time, super aggressive and new treatments, which were harsh, but it worked and it really helped me for a long time. And then I did a lot of body work and some alternative pieces too to kind of support my system and fight the inflammation. And then I had a car accident, so I dealt with chronic pain throughout my late 20s. And then at 34, going on 35, I developed thyroid cancer. And that really kind of changed my whole health trajectory. So it took a long while to recover from that, find some equilibrium. And then I developed rheumatoid arthritis and went into what happens to a lot of people, where you start to have that cascade from one autoimmune to another. And when I was diagnosed with thyroid cancer, we found that the only parts where the cancer wasn't was Hashimoto's. So my thyroid was already attacking itself and probably on its way to dying. Anyway, and there is a high correlation with Hashimoto's and thyroid cancer, particular papillary, from what I understand. So that kind of set off this chain of rheumatoid arthritis to fibromyalgia, Sjogren's. And so through it all, just this feeling of a little bit of one thing after another. And so, and I think that's one of the things that many of us with chronic illness deal with, because you're more susceptible to other infections and other problems, sometimes just because of the illness and sometimes because of the medications. A lot of people with things like rheumatoid arthritis have, medications that are modulating the immune system and trying to turn it down. So that alone can make them a little bit more susceptible.
So it sounds like there's quite a journey here of, this physical journey and experiencing, one illness after the next, this cascade, like you say, from one autoimmune to another, and fast forwarding through these years to to the COVID-19 pandemic. And can you tell us a little bit about that experience for you and becoming sick and just the experience to follow?
Sure. So we were really cautious because of my health history. My son had the option. He's in a small private school, and they did have the option to go to school with distancing and masks, unlike some of the other schools that were shut down. But he chose virtual, a lot to do with my health. So we did try to be very cautious, and we did well until right around the holidays. I still don't know, how we got it, which from what I understand is really typical. At one point I had to go to the ER, and the nurse said it's like 50-50, but most people don't seem to know how they got it at all at the time. So despite being pretty cautious, we weren't like doing absolutely nothing. We did do a few things. We picked it up. And of course it was a big surge in December here in Texas. So I think it was just kind of part of that numbers game, if you will. I first got a rash, And I thought it was, it was kind of like a hive-like rash. And I thought, I guess I had to use like a new body oil or something around Christmas time. So I thought, maybe it was that. And it didn't go away. It didn't go away. And then about 10 days later, I started feeling really bad. And I said to my husband, I wonder if this rash had something to do with COVID. Like, I do not feel right. But I wasn't running a fever yet. I didn't have any of the typical starting symptoms that I had been reading about. So sure enough, I Google COVID and rash, and it's a rare first symptom. So I rapidly started telling everyone I knew, FYI, this is a rare first symptom, which is kind of typical of my body. It does it the sort of the not typical way, right? So I guess I probably shouldn't have been surprised. When I got tested, my husband also tested positive, but was asymptomatic. Thankfully, my son never came down with it. We did the immediate, isolate within the house. And that same day that I got my results back, I started to run a fever. And then I proceeded to have a fever for 54 days.
Wow.
So that was the part that was tough, because on the one hand, I was a mild case, right? I didn't have the extreme symptoms. I actually never lost my sense of taste or smell. I had the horrific headaches that some people talked about. And it was a low-grade fever, but it was so relentless. And I'd forgotten, that's one thing I don't run a fever very often. Some people with RA and other autoimmune sometimes run fevers as a part of their symptoms. That doesn't happen to me very much. And it was just a reminder of how draining that can be on your system. So that was probably one of the hardest parts. The headaches were pretty relentless. It took me a long time. So I had 54 days of fever. Then it would be like gone for a few days, back for a few days, gone for a week, back for a week. So that took a while. And I actually still have the rash here 6 months later. That was started with. I can't seem to shake the rash for whatever reason.
And has it changed in any way? Gotten worse or better, or it's just stayed the same?
Yeah. So I just got my second dose of the vaccine on Saturday, and I would say it's worse since getting the vaccine for whatever reason. It seems to be flaring up. So it's much better than it was at its best when I was on steroids, which you can't stay on steroids forever. But I did do between the lung, I didn't end up with a pneumonia, but I had inflammation and fluid in my lungs, and I'm still being treated basically for asthma. But I did 5 rounds of steroids, trying to knock this thing back.
Wow.
Just this inflammation response that I think some people experience for the first time, right, with COVID, and then others of us who've had similar, but really, really intense.
Mm-hmm. Wow. So the fever is what's really, really striking me, the 54 days of straight fever. So this was and is absolutely a physical experience, but what about the emotions that came into it for you? Just the mental side of this as well. How, what was that like?
Yeah, it was hard. And, I had started writing my book about coping with life's curveballs and some of the normal change and transitions we have to deal with going through life. And it came out of the pandemic. The first couple of months of the pandemic, I kept hearing myself over and over say some of the lessons learned that I've learned for coping with living with chronic illness for so long. So between my clients and my friends and family, I kept sort of sharing these lessons learned. And that's what kind of spurred the idea of writing the book. So then I developed COVID as I'm getting close to finishing it. And then everything kind of goes, wheels off. And that was really hard. It was tougher on me than I thought. And I think part of it was this unrelenting nature of the fever not breaking. And the fever was supposed to be the marker of when you're allowed to, kind of break some of your isolation. And so that was very tough mentally and emotionally. And I felt a little challenged, I guess almost okay, here you go. You walk the talk. You're working on this book, the lessons learned, and here you go. You're going to have to dig deep, girl. and pull yourself back out of it. And that's really where that poem came out of, because I couldn't get the energy to write again. I wasn't seeing clients. I wasn't working. I was getting a little bit, maybe not full-blown depression, but I was down and struggling. And that sort of no end in sight feeling, everybody checking on you, meaning well. And of course you're grateful, but you keep feeling like, yep, nope, not better yet, not better yet. And it's really, I think people underestimate how hard that is on the patient. Mm-hmm. There's almost like a sense of failure, which sounds ridiculous, you know, from an outside perspective when you have a step back or once you're better again, but you feel like you can't tell people what they want to hear. And you don't even know what to tell them. And with COVID, the doctors don't know what to tell you. There was no set treatment protocol. Everybody has been so different. The list of symptoms is so vast, you know, and varied. Doctors were learning about it as fast as patients, or vice versa. So it made it kind of tricky. And I happened to just see someone post something about this poetry contest. And I looked at it and I thought, what the heck, I'm sitting here. Maybe this will somehow get my creative juices flowing. No one's expecting anything of me. You know, I'm not promising anything. I just thought I'd give it a whirl. And what came out was super cathartic. And I wrote about this struggle that I was having. Even though I'm a coach, even though I'm writing this book about it, the reality of how hard it can be when you're in the thick of it. And that you do have to keep digging deep to pull yourself out.
Yeah, this piece about failure is really interesting that you mentioned that. You know, of course, well-meaning family, friends, coworkers, you know, all of it checking in on you and saying, you know, hoping it, you know, with the hopes that, okay, you are feeling better. It's been this amount of time. It's been, you know, okay, hopefully she's feeling better, but you're not. So, you know, what are some ways that you manage that with, you know, within your, you know, your support circles, but also within yourself?
Yeah. So, like I said, that poem sort of surprised me what came out. The exercise, you had to use 30 words. So they gave you 30 words that had to be included in the poem. So what came out was what needed to come out, I think, right? For me, it was very cathartic. I always, off and on throughout the years, I've always been someone who journals. And so for me, writing is helpful to just kind of dump some of the emotions and the swirling thoughts, get a little perspective, put it outside of yourself. And then I decided to try something really different. And as I was starting to feel a little bit better, but not like all the way better and not quite ready for work, I signed up for an online art class. And that was also fun. And so for me, doing some of the creative things over the years, and this art class was a reminder of that, you start to feel sometimes with chronic illness that, like, if I can't do these things that I'm supposed to do, I'm not allowed to do anything. That, like, somehow you're cheating the system or something, right? And so developing a new hobby, getting outside, for the pandemic, sitting outside, going on walks, I think a lot of people experience this. I was reminded how soothing nature is. Just, we have a bird feeder. We'd had a bird feeder, but I just never had spent as much time sitting around watching it, right? And so really enjoying the birds. We started noticing the migration of who was coming in our backyard in a different way. We had baby birds, you know. So just being outside, that was one thing I tried to do a lot, was just lay outside in the sun and read or take a nap outside in the fresh air of the sun, kind of old-fashioned convalescing, like you know, now you'd see in the movies where they're at the sanatorium and, you know, they're rolled out with the blanket into the sunshine. For me, being in the fresh air and the sun, some of these old-fashioned, honestly, remedies and the way we used to deal with healing, I think need to come back in a little bit stronger sense. I will say, because I've dealt with chronic illness for a long time, I have a pretty good network of medical and practitioners. My family doctor is an osteopath, and unlike a lot of people with long COVID, I had great just emotional support from her. I saw them every single week since I was diagnosed, for months. So first it was over video, and then it was going in and seeing them. and she does osteopathic adjustments, which are nothing against chiropractors, but for some people with like connective tissue issues like I do, it can be too harsh of an adjustment for certain bodies. But that osteopathic manipulation, they basically move every joint, they keep you in alignment. She worked on my lungs a lot. So getting that body work in addition to, the hardcore steroids, that combination of techniques, I guess is what I'm trying to say, was one of the things that really helped me. And it's one of the things that I feel like has always helped me pull out of the hardest spots health-wise, that you need to tackle it from more than one perspective.
So it sounds like, some of these practices you have developed for yourself over the years, just in managing chronic illness. You said journaling has been a practice for you, building this care team around you, like your osteopath. And then in this more recent time of crisis with COVID, being able to like really pull on these things and just like ramp up in your own self-care. I love that you're speaking to some of these practices, like, going outside, being in nature, fresh air, sunshine. Like anecdotally, we know these things are good for the soul and good for the mind and good for the body. And how great that we have research coming to support these as well, like the health benefits of being outside and in green spaces, and research supporting journaling and writing as something very beneficial for health. So I love hearing you speak to some of these practices that have supported you, and the creative side of it too, like pulling in that and using that to support you in this health journey. One thing I'm curious about too, Christine, we're talking about this pandemic that is new for every single person on the planet, including medical professionals and health professionals. Can you speak a little bit to, or speak further, I guess, to that experience with walking into a doctor's office, or, trying to manage care, in the medical office when, this experience is going on, and the newness of a virus? What has that been like?
Yeah, very difficult. So this is one of the things that, I already had a pretty good team of people, but once you're diagnosed with being COVID positive, they don't want you coming into the office. So you're trying to do this over the phone, over video. In some of my long COVID support groups that I joined on Facebook and things like that, there were people who had been sick for months and months on end with, lung implications that hadn't even had a doctor listen to their chest. So, it really brought to mind the flaws and cracks in our healthcare system. I think for a lot of people, when you live with chronic illness, you start to realize how much I don't want to say on your own, but you have to save your own life. You have to manage your own healthcare. You have to be your own advocate. And sometimes that is also your family and friends being the advocate with you. I learned that having someone else with you, right or wrong, sometimes makes doctors believe you, versus putting you in this category of, oh, she's just anxious, she's done too much medical research, this can't be right, this isn't the typical way something presents. Having someone else there as support and sort of second your own advocacy can help doctors to kind of sit up and listen differently. That's like a big thing I've been noticing, of how many people have been dismissed with long COVID or post COVID. And it's not the first post-viral syndrome by any stretch, but dismissed for the anxiety and depression. And of course, being sick for a long period of time, or to have a complete health crash and loss of health very rapidly, can cause depression and anxiety, because it's such a loss of your life as you know it, your inability to function, to care for yourself, to provide for yourself or for your family, for parents. I think this is one thing that long COVID has opened some people's eyes to, of just how difficult it is to parent through chronic illness. And again, just there's a shortage of resources. And our specialists, what I started to say earlier is that when you have a chronic condition, you often see more than one specialist. So, maybe my primary doctor is my regular doctor and my rheumatologist for the rheumatoid arthritis, the psoriatic arthritis, the Sjogren's, et cetera. But then I also have to see the eye doctor in a much more in-depth way, right? And then the retina specialist because of my medication and the implications there. And then the pulmonologist for the pieces that have happened to my lungs over the years, right? So you start going between specialist to specialist and you start to realize that the good ones will update each other, but not always without asking. And that what you see nowadays, I'll tell people, get your medical records. And they'll say, oh, I've got that in the patient portal. Well, you don't. You don't have everything in the patient portal. And when you start to see what's in your actual doctor's notes, the full lab reports, a letter from one doctor to another, there can be some eye-opening, sometimes upsetting characterizations and information in there. And there can be some missing pieces, missing links. So I think long COVID has brought to light what so many of us chronic illness warriors have already known, is that there's some real cracks and flaws in the system, and that you really truly have to be your own advocate. I saw that in a lot of people in these Facebook groups who were kind of like shocked. They've been sick for the first time ever for even like 2 weeks to start, right? And then it keeps going and it keeps going. And this realization that it's not that simple to get answers. I know some people are frustrated. I'm actually amazed that we even have a name long COVID off the bat, that there's already long COVID centers. I mean, like people with ME and fibromyalgia, went decades and decades, Lyme disease, decades and decades of being dismissed until told it was psychosomatic. So I actually feel like the medical community has responded pretty quickly and rapidly, maybe because it's been such an unknown and rapid changing, and it just kind of crashed on the whole world. There's been an urgency that other conditions, I think, haven't seen.
If we're identifying silver linings here, I think this is a big one, that this long COVID with this massive amount, tragically, right, just hundreds of thousands of people who are recovering from COVID with long COVID, post-acute sequelae condition. That it is forcing literally the world to everybody, look at this and let's identify a way through this and, a treatment and to manage this, which is going to have really positive implications for other chronic illnesses like ME/CFS as one example, right? That just for decades, because there haven't been such a massive amount of people suddenly in the global awareness. So, I wanted to maybe circle back to something that you said just a moment ago around parenting, as a parent and a parent living with chronic illness, with autoimmune disease, and now, long COVID on top of that. Can you speak to that a little bit further, and even those who might be listening in as parents and going, oh my gosh, like how do I manage this? How does one parent with a chronic illness?
Yeah, I'm already tearing up thinking about it. I'm so grateful to be doing something like this and for the work that you're doing, because I do think it's important people feel alone, with all kinds of conditions, whether it's physical or mental health issues and experiences in life. And most of the time, we're not the first and only to be dealing with it, but you can feel very alone. And I saw that with a lot of, especially the young parents in the long COVID groups who, had really little kids who need a lot all day long, especially in this scenario where they were home. It's not like they were off at school either, and not always in a position where either they didn't have support system nearby or it wasn't safe for the support system to come, like your parents who might be more susceptible to COVID to come help you with the children wasn't always an option. So again, this put, I think, like an added strain to what's already a hard situation when you're a parent with cancer or chronic illness. When I was diagnosed with thyroid cancer, my son was 18 months old. So I really felt what these parents were sharing, and that sort of deep despair of feeling like, you know, I could hear him crying and calling for me, and he was being cared for. He was, you know, in the arms of his babysitter or my sister or grandparents. And we were lucky to have people nearby, but you can hear them calling for you. And, you know, at the time with thyroid cancer, you go through a process when you had I had radioactive iodine. And so you go through a process of withdrawal to where they removed my full thyroid, some of my lymph nodes that had been where it had spread. And you go every single day withdrawing from the thyroid hormone until you know, eventually you would die if you never got it, right? Like that's sort of what would happen, the way your thyroid does so much for your system. But it was a 2-month process. So it was like every single day, less and less and less, to where I couldn't even really lift a glass of water to take a sip. My muscles, there was just no energy at all in my system. So I'm like this, like a lump in the chair, and I hear my baby crying for me, and I'm not holding him. I'm not spending time with him. And again, he was safe, he was loved, he was cared for. But what that does to your, you know, innate charge as a parent, it's that feeling of failure again on a certain level. That, you know, I'm not doing what I'm supposed to. People start to feel worthless, you know, and then you have all the tricks your body's playing on you because your system isn't well. And a lot of these different issues start to affect us biologically with the hormones that are impacting anxiety and depression, you know, even if the situation didn't sort of provoke anxiety because you don't know what's going to happen with your treatment. Am I going to get better? Has it spread? You know, all those different things that are going on in your minds. So it can be tough. And I think first thing first is having that support to help you with caring for the child. And what we learned the hard way, way back then, that we were able to course correct was give us the worst case scenario. There's this emphasis on being positive and optimistic, especially around cancer, like this idea of, again, you know, you've studied the mind body, like there's good reasons to want to give positive messaging to our system. But sometimes in practice, it gets a little twisted between, we're just going to focus on the positive. And that isn't always helpful. So knowing the worst case scenarios, knowing the spectrum of what can happen so that you can prepare. I finally had to say, you know, when I was going through the radioactive iodine, like, I need the worst case scenario here. I've got to, you know, it's closer to 2 at this point. I'm like, I've got a little one at home. And finally they're like, oh yeah, you need to leave the house for at least 5 days because you're going to be radioactive. And they're more susceptible to, so no, not just you alone in the bedroom for 2 days isn't, you know, and you don't know how you're going to feel. And then also for the baby, out of sight, out of mind in certain ways was easier. So we learned, like, give us the worst case scenario. And I had to fight some doctors on that. Even back then with when I had my thyroid out, we said to them, like, my body doesn't react the typical way. What's the longest I'll probably be in the hospital? Because again, we're trying to get the grandparents to come take care of the baby, like 2 days max. You know, usually people are home within 24 hours. Well, I was there 5 days. My calcium would not regulate. And your calcium impacts your heart because it impacts all your muscles. So they would not let me leave. I was on IV calcium. And so, and my doctor said, you tried to tell me, you tried to tell me. And this is where that importance of really saying the truth of what you need, the truth of how bad you feel to your doctors matter. Because if you don't tell them, they don't know. And they learn along with us, you know, in their practice as they develop. And I don't know if I kind of went off on a tangent on whether that helps on the parenting. I will say it's gotten easier as he's gotten older because, you know, it's just less demanding. You know, he's 17 now. He can make his own food and do his own thing. But even he said, I was, you know, quarantined for a long time. like 30 something days. And he even came to my door one day and said, I missed you. And for, the 17-year-old boy to say that, it pulls at it pulls at you as a mom.
And they never stop being our children, right?
Yeah, exactly. You never start not feeling like I'm supposed to and I should be, right?
Well, it just in our remaining few minutes here, Christine, is there anything else that you would just like to share with regards to your journey, or even just any imparting wisdom?
So I would say, listen to yourself, trust your intuition, listen to your body. I will tell you, this is the lesson I've had to learn over and over, and I'm getting better at it. But I say, listen to the whispers. So like, the idea of like a flare, which a lot of long COVID patients are going through, and people with like RA and fibromyalgia experience, listen to those whispers when you know it's coming on and pull back hard. Don't wait till your body is like screaming at you. And to be kind to yourself. And also what I would just encourage employers, family, friends, the medical community is to, I'm gonna get teary again, please believe the patients. And I'm tearing not for myself so much as, well, maybe like my long ago past, but like the things I have read in these Facebook groups, it's heartbreaking when your family doesn't believe that you can't function, when your friends are like, you can't be that tired, so-and-so had COVID and they're better now, or whatever. I don't know what this is, where people's reaction is to minimize or be kind of a Pollyanna of, oh, it'll just be better. Validate and just believe them. Nobody wants to not feel well. So I would just urge everyone to please listen to the patients and believe them and ask them how you could best support them.
Well, thank you so much, Christine, for being here with us and sharing your story and sharing your thoughts and just being a voice of inspiration too through all of this. It's been so wonderful to have you here.
Thank you so much. I'm grateful for the chance to speak with you.